All right. Well, thank you everybody for joining us this morning. This is Rebecca Gleason with the Western Transportation Institute. And our objective today is to bring stakeholders together to prioritize transportation needs and determine which pilot projects may be the most feasible. Your experience and local knowledge of transportation issues is critical to prioritize the needs and decide what solutions best meet those needs in the western Arkansas and eastern Oklahoma area. Let's see, I am going to give myself presenter capabilities here so I can move the slides. Let's see. All right, so this is our agenda for today. Reese Brewer with the Frontier Metropolitan Planning Organization is going to give introductions and a project overview. And then David Kack here at the Western Transportation Institute is going to give a presentation for about 20 minutes. And then we'll break into small groups for discussions. And we really would like to hear your voices. And then we'll ask you to report back to the main group. I think we'll just have 2 small groups with the number of folks we have here. And then we will end with, wrap up for about 5 to 10 minutes. And let's see. So Reese Brewer will speak first. And Reese acts as the Transportation Director for the Frontier Metropolitan Planning Organization for the Fort Smith area. He successfully led efforts to implement bike share, integrate health into the design of transportation infrastructure, and ensure communities in the region have improved access to local parks. In addition, she wrote and received the inaugural Parsons Smart Cities Transforming Intersection Challenge on behalf of the City of Fort Smith and the Arkansas Department of Transportation. She has served on the Eno Center for Transportation's Freight Funding and Finance Group and was a contributor to the Eno Center for Transportation paper, Delivering the Goods, Recommendations for Funding a Federal Freight Program, along with serving on Transportation Research Board committees. While the focus of her work is in transportation planning and freight infrastructure, Reese received her Master of Science in Intermodal Transportation Management from the University of Denver, obtained certificates from the University of Maryland Senior Management Operations Academy, I-95 Corridor Coalition Freight Academy, and attended the Florida Coastal School of Law, studying transportation law and policy. And with that, I will pass the presentation on to Reese.
Thank you, Rebecca. For those who would like to know how this project began, it was approximately this time last year in October that Rebecca and David's group from Montana State University came and visited us. And the funding for this particular project was provided by the USDA National Association of Development Organizations Technical Assistance for Rural Transportation Systems. And what Audity and Frontier wanted to investigate was the feasibility of a rural transit hub for western Arkansas and eastern Oklahoma. And we wanted to make healthcare, employment, and higher education opportunities more accessible to those experiencing transportation barriers, and basically literally creating pathways to success. And what we heard from the last session was how could technology be incorporated into a transit hub, how to identify a hub model that could be implemented over time, what would we do to coordinate partners such as community leaders, existing transit operators, medical providers, employers, and educational institutions, along with identifying funding opportunities, and then, of course, examine what exists across the nation and analyze our local transportation-related planning documents. So I definitely would like to acknowledge Western Arkansas Planning Development District, Sasha Greist, who is our executive director, and also on the call is Ashley Garris, Tracy McKenna, and Cody Schindler, who's a transportation planner from Frontier MPO. The Western Transportation Institute team, Rebecca Gleason, who's research engineer, Danae Giannetti, research engineer, David Kack, who is your executive director, Andrea Ham, who is a research associate, and Dana May, who does proposal development coordinator, and then she is assisting us today with this presentation and all the technical stuff. So if you have any questions or you're having any trouble with technology, feel free to put a note in the chat room and we'll see how we can help. So today we just would like to do some brief introductions among the folks that are here today, and definitely want to acknowledge a lot of the folks that have been involved with this along the way: Fort Smith Transit, the universities, health care organizations. But today we'd just like to have your name, your title, organization, which community you're from, and why you're here today. So I will start with Father Paul.
Great. Thank you, Reese. Father Paul Fetzko. I'm the Vice President of Mission for Mercy in Fort Smith. Community Health and Access is one of the departments that reports to me. So, very interested in increasing access to care, specifically to health care. So thanks for the invite.
My pleasure. Our pleasure. Elaine
Recker. Recker, I'm a renal social worker at Fort Smith Regional Dialysis. We have patients that come in from 6 a.m. and that last shift ends about 9:30, quarter till 10, and our new patients come in on that third shift always. And so we have a lot of difficulty with those patients getting here. Well, actually, they can get here, but they can't get home. If they ride the Medicaid van or Fort Smith Transit demand bus, get here, but they can't get home. So we are interested in how we can participate to increase the availability of transportation for our patients.
Thank you, Elaine. And we have someone in the background, if they could mute their speaker. We're just catching either movement or something. Thank you. Heather Edwards.
Hi. I am now the Sebastian County Coordinator for the 100 Families Initiative. And transportation, of course, is a huge barrier for our service population, focusing more on employment, but also accessing services through the kind of holistic care model. We're looking mostly at low income because we're focused on families. So we're looking at people who are a guardian of somebody who's under 18. And so that's kind of why we're interested in accessing through employment, healthcare, et cetera.
Thank you, Heather. Good to hear from you. Jarena Storm.
Good morning. My name is Jarena Storm. I'm the Government Affairs Liaison to the Office of Mayor George B. McGill in Fort Smith, Arkansas. We are interested in providing our residents and the residents of the River Valley with adequate transportation so that they can move about and utilize all the amenities that the River Valley has to offer, from healthcare to education to employment, and enjoying our parks and other things. So we want to find out what the needs are and see what we can do to make things better.
Thank you, Jarena. Ken Savage. Ken, you're on mute.
Okay, there we go. Can you hear me now?
Yes.
Okay, sorry. I'm the Transit Director for the City of Fort Smith Transit Department. We're a 5307 small urban transit agency that we're federally funded for the urbanized area, but locally funded for the City of Fort Smith. And so our hope and function is to try to, expand outwardly into the region and look for ways to match some of the federal proceeds that we have, that we can, extend transit out into the region and also possibly later into the evening or through the night. So that's our function, and to see what we can do.
Thank you, Ken. Mm-hmm. Leslie Maddox.
Yes, I'm with Mercy Fort Smith. I'm a community health worker with Mercy. I work in the rural communities, and we're just interested in increasing access to care for our patients.
Thank you. Mayor Martin?
Hi, I'm Mayor Jerry Martin for Alma, Arkansas, and we are as we continue to try to work to get more health care to us, we also are trying to work on being able to have transportation needs met so that we can get people to where they need to be for health care, and not just health care, but we're also interested in some sort of transportation for jobs, being able to get people back and forth. Working with the 100 Families Initiative in Crawford County, again, this is a main topic of discussion right now in trying to help our citizens. So we're very interested in a couple of different aspects of this study.
Thank you, Mayor. Sasha Greist?
She had to get off the call. She'll be back in a little bit.
Okay, we'll go ahead, Ashley Garrett.
Oh, thanks, Reese.
Awesome.
I'm Ashley Garrett with Western Arkansas Planning, and we work with several of the communities, and just being able to find out what all's out there and help try to get, transit and transportation areas to the rural areas is really what we are here for.
Thank you, Ashley. Tracy McKenna?
I'm Tracy McKenna. I'm also with Western Arkansas Planning Development District. I'm here with Ashley and Cody, and I was kind of introduced to this project. I had been to a meeting with that Leslie was at, and we were talking about transit issues in our small rural communities, and then I came back to the office and approached Reese about it, and this project was already kind of in the works, so it was just kind of perfect timing as far as that goes, and just interested in how we can maybe expand transit in our area so that we can better serve our small communities. Yeah.
Thank you. Cody Schindler?
Cody Schindler, Frontier MPO, Transportation Planner. Of course, we do transportation planning for the whole Fort Smith region. And so, of course, we do transit surveys. So we do get to see some of those needs and wants from the riders themselves. And there's definitely a need, just across the river. So, you can only imagine that there's more of a need just outside of that as well.
Thank you, Cody. I see we've got a couple other folks joined by phone. If you would like to introduce yourself, that would be great. Unfortunately, I don't have your name in front of me.
This is Kim Horton. I'm with the Hamilton House Community Resource Center, and we work with families to try to assist them in getting services and getting their needs met. The building that I'm in, the internet seems to be down, so I had to call in. I am downloading the app on my phone, and I'm going to try to rejoin as soon as that gets downloaded, but I went ahead and called in, so I would be here now.
Thank you, Kimberly. Is there anyone else that we need to identify and introduce? Okay, well, hearing none, we'll move forward. Some of the objectives for today is to bring the stakeholders together to prioritize what are the needs for the region and determine which pilot projects could be the most feasible and viable, and then to inspire what's possible by learning from others and working together. So we did who's participating today, and you probably received in your packet the introduction for David Kack. He's the Executive Director for the Western Transportation Institute. And I will have Rebecca turn it over to David, please.
All right. Well, great. Thank you so much, Reese, and everyone for joining us today. I was hoping to be there in person in Fort Smith and be able to meet you all personally, but with things being the way they are still, that we're ending up doing this remote. And so, we're going to, go through it this way and, try and participate as best we can remotely. So it's been a real pleasure working with Sasha and Reese and all of you to get where we are today. And so, we'll jump into this and keep moving ahead. And the most important thing is going to be to hear from all of you. So as Reese talked about, the National Association of Development Organizations, Carrie Kissel, is the person who kind of hired us to help in this process, and then this funding comes through the U.S. Department of Agriculture. So one of the things to remember is that mobility is a means to an end, that we're all out traveling for a purpose, and whether that's going to work, going to school, going to the grocery store, going to healthcare appointments, if we're taking our kids to school, those kinds of things. Mobility means that we can go out and live the kind of life that we want. And certainly if you want to see someone not do very well, take away their ability to get out and about. And so, it's important that we come up with solutions that allow people to get out and live the kind of life that they want to, even if they can't, own and operate a car. One of the things that we talk about with mobility is the cost of mobility. And as shown here, transportation is typically the second highest expense for an individual or a family after housing. And as shown in 2019, those two expenses can easily be 50% of your expenditures. Depending on where you live and how much you commute, those costs can certainly be over 50% of your budget. I thought it was interesting to look in 1917, transportation was just 2% of a family's budget, or just the sixth highest expense. And so, again, you have this interplay between housing and transportation, but they are some pretty significant costs for individuals and families. Another way of looking at it is the American Automobile Association does an annual review of the cost of owning and operating a vehicle. And so this is the most updated information, and you can look across, different vehicle types and how many miles you're traveling to look at what that estimate is. And so on average, most people will say it's about $8,000 to $8,500 a year to own and operate a vehicle, which is a pretty significant amount of money. And certainly as we talk to some people who are outside the Fort Smith city limits, you don't have to drive too far to all of a sudden start putting 12,000, 15,000 miles plus a year on your vehicle. And so, again, we want to look at ways, modes of providing mobility to people without this significant expense. And so, a lot of people say, okay, it's great. Yes, we know we need some more options. What do we do? How do we start? And so, I think from the first presentation, the kickoff meeting that I wasn't able to make last October, about a year ago, looking at some quotes, Theodore Roosevelt said, do what you can with what you have where you are. So, yes, we'd all like more money. We'd all like more time, more staff, more vehicles. But, let's look at what we have and make the best use of that. And then certainly whatever we're going to do is going to start with just starting. At some point we need to pick what's going to be the best solutions to try them and not overanalyze anything too much. And I tell people that, once you decide what to do and start operating it, you're going to learn more in that first year of operations than you probably ever thought of while you were planning. And so if you get a little smarter every year, you're doing a great job, and you just keep moving along and doing better and providing that mobility. So we've done some different documents that Rebecca and the team have shared. So we've looked at some key demographics and trends, getting input from people, looking at transportation needs, and then looking at those existing operations. So with the demographics, these are the counties that are in the study area, the two in Oklahoma, and then the 6 in Arkansas. So looking at the Fort Smith urbanized area, again, one of the key communities in the area, a big chunk of the population in the study area. Once you get out of Fort Smith and that urbanized area, the size of the communities get relatively small. Most communities are 5,000 or fewer people. And certainly when you look at the land area, most of it's rural. So kind of spread out, lower population densities, which means that those mobility options that you provide sometimes are a little more challenging. When we talk about those who might need mobility options, we talk about people maybe becoming transportation disadvantaged. So these are folks who really don't have those options of owning and operating a vehicle. So what we saw in those 8 counties is that just about a little over 21% are under the poverty line. That's certainly more than the U.S. average of 14%. The population is slightly older. 18.4% is 65 or older compared to 15.2% for the U.S. average. And then 21.4% are persons with disabilities, and that's almost twice of the U.S. average of 12.6%. So these are individuals who tend to have more mobility issues, again, whether it's being able to afford to own a vehicle, being able to operate a vehicle. And so these are folks who tend to look for those mobility options to see what else can help them get out and do what they need to do and live the life that they want to live. When we talked about some other transportation needs, interviewing folks like you, having some discussions looking at other reports and those kinds of things. When we looked at higher education, Arkansas Technical University, over 3/4 of the students there are eligible for Pell Grants, which are based on income. And then at the University of Arkansas at Fort Smith, there over half the students are eligible for Pell Grants. We heard earlier about the need for mobility, travel to medical appointments. Certainly folks like dialysis and cancer treatment patients might have those kind of ongoing treatments that require that 2-3 day a week travel. And missing those is not good. And so, we look at the cost of emergent trips if someone doesn't get to those regularly scheduled appointments. So we certainly want to get people to those regular care appointments, because missing those has a pretty big impact on their health, which is not good, and then can certainly lead to higher costs later for everybody. We heard too about workforce shift work. That the Fort Smith Transit is not unique in that they're not running 24 hours a day. So there are people with different shifts who might be able to use transit to get to the start of a second shift, but Transit's not running at 11 p.m. or midnight when those folks are done. So what can we do to make sure that people who want to get to work have a way to do that? So there are certainly options in the area. So as we talked about, the Fort Smith transit system, an small urban fixed route system, and as Ken was talking about, they know that there are needs out there that they can't meet right now, and so how do we look at finding funding for them to expand their services to do that? You have the Western Transit System, which is known as a FTA Section 5311 provider, rural transit provider. They're a demand response system that covers all of the counties in Arkansas that we're looking at, and so is an option out there as we look at what we need to do to grow those options out there for people for mobility. 17 organizations in the 6 Arkansas counties receive FTA Section 5310 funds. That's a capital-only program, and so while those different organizations get assistance in buying vans, small body-on-chassis buses, those kinds of things, it doesn't provide those underlying operating funds. And so they're typically buying those to operate for senior centers or specialized programs, but it's important to know that those vehicles are out there and are assets that could potentially be used in a coordinated effort once we decide to move forward. And then there's 3 tribal transit operations in the area. And again, talking about how we provide transportation to folks, those are certainly people that we want to keep in the conversation as well. So when we talked initially about, what the needs are out in the counties that we're discussing, some of those key results that jump out again were a higher percentage of people who could become transportation disadvantaged than we see at a U.S. average. Again, people with disabilities, people 65 and older, and those living below the poverty level. There are challenges in accessing the education, healthcare, and work environments. There are people who need different options, who aren't getting where they want to go, when they want to go, based on what's currently available. This discussion of need for coordination. What we don't want are vehicles following each other in the counties or into Fort Smith. We need to make sure everyone knows what everybody else is doing, and again, to use those resources as effectively as possible to get the best results. A definition I like to use from Merriam-Webster Dictionary is coordination is the harmonious functioning of parts for the most efficient results. And so again, lots of different organizations, how do we all work together to improve mobility in the area? One of the things when we were looking at different plans is both Arkansas and Oklahoma transit plans, statewide plans, talked about regional mobility coordinators. So we'll talk a little bit about, that previous webinar that was done, and a lot of folks who presented were mobility managers, and those are people who basically their job is to do what we're doing now, is to talk to different organizations and folks, talk about what the needs are, figure out some options that could be implemented, and really seeing those through implementation. And so it's nice to know at least that at the state level that they recognize there's that need there. So when we did a literature review and looking at, again, options that might be good for this region, regional mobility, how is that done in other states? Certainly looking at medical transportation options. As Reese said earlier, are there technologies that can be put in place to help with coordination, help people to request a ride, help providers get that ride to folks? And then certainly looking at cost benefit and options for funding some of these things, as Ken talked about, again, knowing that the need's out there, but how do we find additional funding to help put some more service into implementation? So we talked through a lot of different options that are out there using transportation network companies, Uber and Lyft, as well as taxi services. What can we do to get people ride sharing, sharing a ride in a car? Can we implement van pooling? Those are options you typically see to the large employment centers. Transportation vouchers, is there a way to provide some funding for a neighbor or family member who gives someone a ride? Talking about volunteer driver programs, people who just say, hey, I'm traveling around and I'd be happy to give a ride to someone who needs it. I don't need to get any pay for that. So how do we do that? Car sharing is a way for short-term car use. For most of us, our car typically sits parked probably about 22 to 23 hours a day, so we're not really using it. So for someone who just says, hey, I need to run a few errands and I just need a car for an hour or two, can we make a vehicle available to them for a relatively small payment? And then we talked about what's known as mobility as a service or mobility on demand, using technology to get people a ride when they need it. So a lot of different options out there for folks and things to consider as we talk about what might make the most sense implementing in the area. So, what we found out of that document is there's a lot of people who have done a lot of different things in different areas. And so those are things that can feed into the fixed route system in Fort Smith and certainly can complement, what's done in the rural areas. We've got to coordinate and collaborate. So a lot of people might think, well, I'm not a transportation person, I'm not a mobility person. But it's important to understand those needs that you have and to discuss what options might work. And so, we need who you'd normally think of would be a good partner in this process and certainly reach out to other folks. And then what we found even from that September 25th webinar is that, technology isn't always the answer. Sometimes people say, oh, I need to have this technology. And it's like, well, why do you need it? It's not going to solve all your problems. You have to have a good understanding of how you'll use the technology to solve some issues. But in and of itself, it is not a solution. One of the things we've talked about are pilot programs. So, if we think there's something about van pools or car sharing or those things that might be a good solution, is to say, let's test it. Let's talk about a year or two program to see how it works. Let's evaluate it and see if it could be a long-term success. So sometimes people fear starting something because they feel like it's going to have to go on forever, and that's not the case. And so let's look at trying some things and see how they work, and we might find a few things don't work out well, but hopefully we find some things that do work out very well. And certainly we found there's not a one-size-fits-all answer. What might work in some place like Washington or Oregon might not work in Arkansas or Oklahoma. You might be able to find successes in things that didn't work in their communities. And so, you know, as we talk about, there's not a silver bullet, but there's probably silver buckshot that, you know, one of these solutions isn't going to work for everybody for every trip. And so we need to think about there's probably going to be multiple modes or solutions that are ultimately going to need to be implemented to make sure everyone has a ride to go where they want to go, when they want to go. So again, the purpose of this session is really to hear from you folks. Again, I was hoping to be there in person, but we're going to do it this way. And so again, we don't expect any of you to be transportation experts, but your knowledge of what the needs are, you know, what you've heard, has someone been able to get a ride somehow? Those are the things that we want to talk about in the next 45 minutes or so. So, you know, is there someone you know that are facing transportation barriers that are able to get around? How are they doing it? And again, it might be a combination of friends and family and different organizations and different things. You know, we talked about different programs, or again, I think this is more where people are traveling. So again, do we need more access to medical facilities? Are there needs to get people to the colleges and university, to jobs? What are those barriers? And again, what are those needs? How can you help? Again, you don't have to be an expert in transportation, but to say, we can provide information, we can share information. You know, we can organize a community meeting. We can do these things to help this communication flow and ultimately be part of the solution. Again, talking about what those highest priority needs are, we're probably not going to be able to tackle all of them initially. So what are those key needs that we have in the community? We want to know who else should be part of this discussion. Are there key individuals? Are there key organizations that we need to bring into this as we have these discussions and move towards finding solutions? And then if we have time, you know, based on that discussion that we had at the end of September, talking about different options, you know, again, is it car sharing? Is it van pooling? Is it voucher system? What things might be able to be implemented? And then again, just this discussion of keep moving forward. You know, at some point here, WTI is going to pass the baton to you folks back in the greater Fort Smith area. And, you know, how does that momentum keep moving forward? Certainly, we want to see things happen. We don't want the end of this to be a report that Reese and Sasha get and it sits on a desk somewhere. So we want to make sure that at the end of this, there's some clearly identified steps for, you know, again, what solutions do we think could be implemented? Who's going to do that? We've got funding figured out to do that pilot, and we keep moving ahead. And so with that, what we want to do is break into two small groups. There's about 16 of us participating today. So we want to break into two smaller groups, talk through these questions, and then what we'll do is come back at about 11 or 12:30, I should say, your time, to report back to the broader group kind of what we've discussed around these questions, and then talk about some next steps. So with that, Rebecca, I think you've assigned folks to different groups.
Yes, thank you for your presentation, David. I guess before we move into groups, I do see one question in the chat box, and maybe, would open it up to other questions as well. But Dorina had a question. Do you have a job description for a mobility coordinator? And I will say that when we were doing our literature review, we found out that in 2010, a mobility manager handbook was written. There was a mobility manager hired in the Fort Smith area, and it was a short-term grant program, is my understanding, and there was a handbook that was written specifically for your area. It is a little bit dated, and it hasn't been, I don't know that a lot has been done since then. And also we also uncovered through our literature review that there's a National Center for Mobility Management that has all kinds of different resources. We haven't written a specific job description. That could be something for a mobility manager. That could be something that could be a next step, a sample job description or something that we could put into our final report if it's helpful. And David, do you have anything to add to that about a mobility manager job description?
Well, no, I think certainly the resources are there, as Rebecca mentioned, and so that the key thing will be if it looks like that is going to be a good step, and it's something again that both Arkansas and Oklahoma had in their statewide plans, is to look at those regional mobility managers. And so one of the next steps might be talking to Arkansas DOT and saying, hey, would there be the possibility of getting funding for a mobility manager? Can we hire someone at least for a couple of years to help us with this process? So I think the resources are there, and again, just to talk about how to move forward and make sure that happens.
And I did just add the website for the National Center for Mobility Management into the chat box as well, so it's available for folks. Are there any other questions for David? Okay, I don't hear anybody. If you did try to speak, please unmute your microphone and try it again. So while David was speaking, I attempted to create a breakout room to put about half of the participants into a breakout room, and we are experimenting with this technology, so we are hoping that it works. So please bear with us. But yeah, I do see that there are 3 folks that are together on the call with the Western Arkansas Planning, and so we'll put all 3 of you in the same room. So yeah, so what I'm going to do now is hit the start, or let's see, breakout session assignments. Hold on a minute. It looks like I might have lost those assignments, or the box disappeared on my computer. So if you just bear with me for a minute, I'll try to do that again and break us into roughly 2 groups. So half the folks, like some of the folks that joined by phone only and didn't have an internet connection, you'll stay in this main session. And if this works properly, the other half of the folks will go into a separate breakout room where you can have a discussion. So let me try this once more and see how it works. Ken, I didn't see your name show up, so I'm thinking that maybe you joined by, Ken Savage, I'm thinking that maybe you joined by phone. I'm not sure why your name didn't show up in the splitting the groups up.
I'm not sure, Rebecca. I joined through the portal that you sent out, so.
Okay, huh. Yeah, I guess the only way to sort of learn how this technology works is to try it out and make mistakes along the way. Huh, yeah, it's odd that your name doesn't show up for an assignment here because everybody else's does. But I will see what I can do. Let's see. Grace. Sorry, this is taking longer than I anticipated. I had sorted it out and then the box disappeared and and a lot of the names disappeared. So maybe I'll try start breakout session and see if it breaks out half of you to another room. Let me try that. It doesn't seem like that worked. So let me try one more time to break folks out. Breakout session assignments. Please.
So Rebecca, when you did that, what I saw on the right-hand side where participants, it said breakout join. So.
Okay. Yeah, but nobody was in it. So let me just try this one more time.
If we have to join it then.
Heather. Elaine. And Leslie. Okay, I'm trying that one more time. Okay, I put 6 folks into a breakout session. And Elaine, Reese, Leslie, Heather, Father Paul, and Mayor Martin I assigned to a separate room. And so let me start that, and then please unmute your microphones when you get in there and see how, let's see if this works. Okay. Hi, everyone. Can folks hear me in this main group session?
I can hear you.
I can hear you.
I can hear you.
Okay, great. So I just checked in with the breakout session, and it looks like about half of the group went into that session, so I think it's working. And so maybe what I'll do now is pull up those questions on the screen here in this session, and we can do introductions and then start going through those. So let's see. I apologize for my figuring out this technology while we're going. So maybe while I'm figuring this out, we could do some introductions. Let's see, sorry, I'm just trying to find this file. Okay, did the screen change for folks? Can you see a document on the screen?
Yes.
Okay, great. So thank you for bearing with me. And now my whole screen changed, so I'm just trying to see who the participants are in here. It looks like, all right. So maybe we'll just kind of do brief introductions again. And if you do have a video, maybe turn it on so we can see who all is here. But yeah, maybe I'll call your names. Ashley Garris, maybe you can start and just do a brief introduction again, your name and organization and, you know, why you're here. And then we'll go through each person and put a face with a name, and then we can start going through the questions. Does that sound like a good approach?
Hi, this is Sasha Grass. I'm the Executive Director of Western Arkansas Planning and Development District. And in our room, because we're all together, I have Ashley Garris, who is the Assistant Executive Director for Wapatiti. I have Tracy McKenna, who does our community development. And I have Cody Schindler, who is working as a planner with our MPO.
Great, thank you. Wow, so we got a big group there. Okay, and then let's see, George McGill is the next name I see on the screen. I think that's Mayor McGill of Fort Smith. Could you do a brief introduction? George, you'll need, let's see, I think I can unmute you here. There you go. I think I did that. All right.
Well, how's everyone? This is George McGill, Mayor of the City of Fort Smith, Arkansas.
Great, thank you for joining us, Mayor McGill. And yeah, maybe let's see, I'm going to unmute everybody so we can just have a conversation and try to keep it a little more engaging. Jarena Storm, if you could do another introduction. Oh, sorry.
Hi.
We're just doing brief introductions. So
okay, great. I had to run from one office to the other to get the camera on. So I'm Mayor McGill's Government Affairs Liaison. So.
Okay, great. Thank you. And then Ken Savage.
Yeah, Ken Savage, Fort Smith Transit. And I have with me David Hewitt. He's been sitting here patiently listening through this. And David is a driver lead person and helping us through any projects that we do of this nature.
Hello, everyone.
Hi, David. How do you spell your last name?
H-E-W-I-T-T.
A-T-W-I-T-T?
Right.
H-E-W.
As in horse, H-E-W.
T-W-I-T-T.
H-E-W-I-T-T. Hotel Echo.
I think I got it. Hewitt.
Yep.
Okay.
You got it.
Thank you. All right, so let's see. And then we have a couple folks that are on by phone, and I can't really see who's there. So one of them, your phone number ends in a 52.
That's Elaine.
So maybe hi, Elaine. Maybe give another brief introduction. I know we did in the main room, but maybe folks, I'm not sure how many folks know each other here, so maybe your name and organization and why you're here.
Okay. Elaine Brecker. I'm a renal social worker at Fort Smith Regional Dialysis in Fort Smith, Arkansas. We are very interested in securing more transportation for our area so that our dialysis patients can make it to treatment on a regular basis and not have to depend on whoever to ride. If they miss one treatment, it raises their risk of death 25%. So it's very important to us. And our new patients come in on third shift always. So they get off between 9 and 10, and there's no way home. So we're very interested in this project. It's a great thing. Thank you.
Great. Thank you, Elaine. And then there was one other phone number that I can't see the name for that ends in 48 or the last two digits.
Hi, this is Kim Horton. I'm with the Hamilton Heights Community Resource Center. I'm sorry, I tried to download the app, but it won't download. I work for a resource center that helps individuals and families in our community to try to meet their needs and figure out ways to solve their problems, transportation being probably the biggest one that we have in Crawford County where we're based.
Great. Thank you so much, Kim. Great. So, yeah, I guess the goal of this session really is for those of you, in Arkansas to get to know each other better and to kind of talk through some of these questions. So, yeah, it looks like we have, a good team on the phone of folks from, with different backgrounds, and some with the transit agency, some interested in, health, access to medical facilities that have some really good first-hand experience. So maybe what I'll do is just go, read through the questions, and so I'm happy to take notes, and I'll take them on here. And if you see something that I miss or don't get quite right, or another point you'd like to make, let me know. I'd like for when we finish this session, we're allocating about 45 minutes to this session for you all to talk. We'd like somebody from this session to report back to the main group on some of the key discussion points in answering these questions, and just want to ask who in this group is interested and willing to do that. Because we don't want it just to be necessarily our voices, but we want to, hear from you and hear your voices, not misinterpret them. All right, nobody's excited to speak up. Maybe I'll start with the first question and we can figure that out. Oh, let's see. I think I lost my chat box. Jarena, I see your, let's see. I apologize again for figuring out this technology while we go. All right, and nobody's interested in reporting back to the group? I'll have to assign somebody. And I met Ken while I was there in Fort Smith. So Ken, would you be okay with reporting back to the group on our answers here?
Sure.
Okay, thank you so much. So yeah, maybe I'll just start with the first question, and would love to hear your voices. So in your personal stories, I think they're really important. How is someone that is facing transportation barriers able to travel around the region? And maybe I'll start with the Western Arkansas Planning Group. Sasha, Ashley, Tracy, or Cody, if you have any, do you have any sort of personal experience with this question, or have a story you'd like to share?
Hey, this is Cody Schindler. I'll share a little experience. So we do, this transit surveys, and so you do get to kind of see a lot of people who rely on it every single day. And, it's kind of ironic how the days that they don't like are the free ride days, because more people start riding who don't normally ride. And so that affects, the regulars who rely on it every single day. So, of course, they're frustrated that, more people are riding, because these people don't ride when, they don't use it as a necessity, even though they may need it as a necessity at that time. But, to them, it takes them, at least an hour just to go run one errand, and then they have to be able to wait on the next bus to hit the next route. So.
Great, thank you so much, Cody. Does anyone else from that group have a story to share, a personal experience with someone facing transportation barriers? Okay. Let's see. What about Jarena or Mayor George McGill? Do either of you have thoughts or comments about this first question?
Yes. Again, thanks for hosting this. Some of the concerns that I hear, at ground level as I move about daily, is that there's no transportation late in the evenings. Many people work at night, and so after 5, 6, 7. There's no transportation, and they struggle to take care of basic necessities. And so how we manage that, first thing that comes to mind is just increased transportation, increase the number of vehicles used, increase the number of stops, locations where people can board transportation, and simply longer hours where people can get to those jobs that start late evening and then can get back home when their period ends at work. So there's a big void in when transportation is actually available from a public standpoint.
Mm-hmm. Great, thanks. Jarena, do you have anything to add?
Yes, thank you for asking. Our on-demand service seems to be kind of a hit or miss. My mother uses, she's elderly, she has a walker, and she uses the on-demand service. I also used to have a friend that worked an early shift at Sparks and also tried to use the on-demand service, but it didn't necessarily work out as well as we thought it would, as there were other stops in between. So I guess for the same as Mayor McGill, scheduling of our transit service and what we can do to modify what we need. Do we need more money? Do we need more manpower? What needs to happen to make our transit service work for our residents?
Great. Thank you, Jarena.
This is Kim. I work with families almost every day that face transportation issues. The biggest complaint, I guess I'll call it, that I hear about from Fort Smith is the length of time that it takes to get places when you use the transit. But to me, that's a minor problem compared to Crawford County, which has no transit system at all, and no cab systems, no real transportation assistance other than the Medicaid van. So in Crawford County, we're really struggling with coming up with any solution.
Thank you, Kim. Is it Crawford County? Is that what you said? The sound isn't as good as I'd hoped, or my hearing's not as good.
Yeah, I said Crawford County. That's the Van Buren area, in the rural areas outside of Fort Smith.
Yep. Okay, great. Thank you, Kim. Let's see, Elaine, do you have anything to add to that?
I actually have a new patient that is on third shift. She gets off at 9:30 at night, and she is over 65. She and I sat down the first night she was here, and we just brainstormed how can she arrange transportation so as not to overwhelm someone that would be transporting her 3 times a week and coming and waiting 4 hours, or transporting her and coming back. And she's from Oklahoma, so they would have a wait. They'd have to wait for 4 hours. And surprisingly, she got on the phone and on her cell phone, and we talked to her brother and 2 friends on a call, shared call, and they were each one very open to taking 1 day a week or 1 evening a week and transporting her. So that's what she's doing. And she offered to pay them, and they were all like, "Oh, you're a friend. You're my sister. We're going to do this for you." So that's been successful for her. But as born and raised in Fort Smith, Mayor McGill, I am so glad you're on here, and thank you for everything you're doing for our city. I love your ideas. I remember as a young person when we had transportation all over Fort Smith and all over Van Buren, Fort Smith Transit, and we could ride and transfer. And I think we need to get back to that because we have as many, if not more, people that don't have cars. So we're working with a lot of different ways that people get here. We have some that one person brings them to treatment and then another person picks them up. So our patients get real creative, but we have so many that are elderly that can't see at night and can't drive, or they do drive, and we want to say, get off the road. So more transportation would be a blessing for us.
Great, thank you.
Mm-hmm.
Let's see, who haven't we heard from? Ken Savage, or actually, somebody else want to jump in?
Hey, Rebecca. So when you think about transit, we hear a lot about the need and the cry for more. For us, it's about doing the best that we can with the resources that we have, and making the best system that we can, and accommodating the needs that we can. And a lot of it is the design, and the design is there. Some of it is in relation to the requirements that we have, the federal requirements. They're not always. There's just a lot of requirements when you're talking about federal money that you get, which is largely makes up the biggest portion of our budget. There are a lot of federal requirements that are very heavily mandated in not only what you do, but how you do it. So how our system is structured is largely based on those requirements. And again, for us, it does come down to money. And we do, some of the things we do have is institutional knowledge about, because I've been here several years, more than 20 years with this department. So we've tried a lot of different types of approaches and things, and some work, some didn't. But, for instance, fixed routes don't seem to work after nightfall. Demand response would be a better approach. I recall mentioning that the demand response has to make several stops en route. That is very nature of our system and how it's designed, and part of the requirements through the Federal Transit Administration. So some of those things we can't necessarily get around. They're efficiency measures that we have to do for the department. But when asking the question, what we've noticed, I thought was always odd to me, was that people can catch a ride going home a lot easier than they can catch a ride going to work. And that's something that's always stuck out in my mind, is that it's easier to get somebody to give you a ride home than it would be to get somebody to give you a ride going to work. So naturally, we do have a lot of services earlier in the morning. And again, we could also run them late into the evening. But so those are just some of my thoughts.
Great. Thank you, Ken. David, do you have anything to add to that, or any personal experiences with people facing transportation barriers?
No, just like Ken said, we're kind of limited to a lot of our services, but we really work hard to try and, get these services to work in our favor. And we do everything in the world. We've been over backwards to make this happen. So, any ideas that people might have to help us, that would really be appreciated.
Right. Great. Thank you.
Rebecca?
Yes?
I'd like to say, with the demand bus, our patients use that quite a lot, and the transit is so gracious to provide us a certain number of tickets a month, which helps defray the cost for our patients, which is a great service. And almost without fail, they get our patients here by their chair time, and generally they're here to pick them up and get off. So when they get off treatment. So in my opinion, our demand bus is great service, and it does a really good job.
Great. Thank you. Yeah, and if you all just want to talk, I don't need to call on you. I'm hoping it can be more of a conversation, but I'm happy to help facilitate if we need. Are there any other comments for that first question that anyone would like to add on to what we have? Okay. So the next question is there a program outlined in the literature review that would be of greatest benefit to the person currently facing transportation barriers? And I'll just open it up rather than call on folks, maybe just let you all let you jump in as you see fit.
I'm trying to find a couple that had a monthly fee that they charged the patients, and they had some funding apparently that subsidized that, and that sounded like a great thing. They would have a certain number of rides for it was like $11, and they got 20 rides, and then they could purchase more with a discount, and that would be a great thing for our patients. It's just with the non-emergency transport that our patients use, it's like $60 for one trip here in Fort Smith to the dialysis center, and we have no one, even our more well-off patients, that can afford that. So, you know, maybe if there was a cost sharing.
Yeah, that's a great comment. And, you know, some of the voucher programs can do that too, where, you know, the example mentioned earlier where, you know, people maybe have friends or families that they could ask but don't feel good or would like to reimburse them. Some of those voucher programs can offer some, you know, a little bit of subsidized funding to help offset those costs for people that do have friends or family, or, yeah, perhaps for, you know, offsetting the cost of some of the existing options like the non-emergency medical transportation or demand response options that are available. So maybe I'll put in voucher programs here might be a good, you know, one option that could help with that. And the Health Trans program, that I'm not sure if all of you were able to listen into the 2-hour webinar that we did, but we had 3 different guest speakers come in that were all mobility manager folks, and one of them talked about the program in Missouri where they have called Health Tran, where they get some different funding from different agencies and different places and put it together to help provide transportation focused on medical care to help connect people to rides and subsidize some of the cost. And that seems like it could be a good model for your area as well. I'm just curious how many of you were able to listen to that or participated in the webinar?
I was there. Elaine, I was there.
I was there. This is Kim.
Great, and I see Dorina listened to part of it. Yeah. But yeah, there's some really good information in there and a little bit more information in the case studies and the literature review about, you know, some of those programs aimed directly at access to medical care.
Yes.
Yeah. Any other comments about you know, any programs you've heard about or read about that would benefit the person you know currently facing transportation barriers?
I was interested in the volunteer program that one of them had set up, so that the patient or the client paid a certain amount per trip, and then so much per mile that the volunteer got for the transportation. And that sounds like it could be feasible if it was within a good price range that patients or that people could afford.
Mm-hmm.
Have vouchers for.
Yep. Yeah, and I think some of that Health Tran program too was about training volunteer drivers, you know, to help lower the cost and having some, you know.
Yeah, I think it was. That's one of the places. But there's one of the studies here in your draft, which, by the way, is awesome.
Oh, good. I'm glad somebody read it.
It's very long, but yes, it was worth reading. So,
okay, thank you.
You're welcome.
Like David said, we really hope that this is not something that sits on the shelf, but that, you know, inspires some action locally. And, you know, part of this meeting too, this workshop, is to have you meet each other and, you know, hopefully continue the conversation once we're not here anymore.
Right. I
thought that some of, I'm sorry. I thought that some of the medical programs that were using the transportation for medical reasons sounded really awesome, and I think that would be great for like the dialysis program for the people that are on Africa. Some of them I didn't think would necessarily be very practical for day-to-day transportation for other reasons, but as far as getting the medical element in there, a couple of the programs that were outlined in that training seemed like they would really work and be really beneficial for that.
Yes.
Mm-hmm. Yeah, put that health trend because I think, that's one of the main ones. And there are a whole lot. I was surprised when we were putting this together. Medical transportation is an issue all across the United States, and there's all kinds of online toolkits that are there, to help sort of quantify the costs, what the costs are to the medical facilities if patients don't get the care they need and their conditions, get worse, and how that's a much larger cost to everybody in society than the relatively low cost of subsidizing some transportation for medical care.
And I think that if we had more transportation for people who don't have vehicles and want to work, that's a really big barrier for a lot of young people, is not having transportation. And we see that all the time in Fort Smith with young families walking with grocery sacks. If we had transportation, public transportation, we could have those people on the bus, riding a bus rather than trying to walk miles and carry groceries. So it seems to be a really big issue in our area, and maybe we need to be even more proactive with our legislators to come up with some state funding to help us to improve. It would improve our economy if we had more transportation.
Mm-hmm.
Rebecca, one of the studies that I liked, and I think I pointed this out before, is the Pinellas County study where they use the transportation network companies, and I'm seeing that quite a bit, where that's a real interest to transit agencies. The downside is that the transportation that they offer doesn't by itself meet the definition of transportation as far as the regulations and requirements go for our funding. And so that presents a problem when you're trying to stretch our funding into using TNCs. And what I'm seeing is a lot of the, and when I'm saying TNCs, I'm talking about Uber and Lyft, but those types of agencies. But what I'm seeing is a lot of the transit agencies are using state funding or things of that nature that don't have those requirements attached to it. Requirements such as drug and alcohol testing that might be required. There's requirements such as reporting statistics that they may not be able to provide those to the transit agency, where we're required to report on those. But the services that they provide are very attractive in the fact that, they could be hit and miss whenever you need, wherever you need, and whether that be late into the evening or further out into the region. And it's not as if you would be putting out a service out there that you're operating all day long, and some people may use it, some may not. This would be used when needed, and so it's a very attractive, to me, a type of service that we're hoping that there gets to be more of a nexus between them and the transit agencies, and particularly that they would get to where they would comply with the federal requirements. That would really be a help in us being able to use federal funds to access those services. But that was very much an interest to me, And I would like to see us trying to do some sort of a project where we at least use them for part of our service if we can't use them for all of our service. Perhaps you might have to put out a paratransit bus to address those needs with the dialysis, so to speak. But then the needs for job access, as was mentioned, late into the evening, they may not need a van that is lift equipped or something. So just having a ride to work, so to speak, an Uber or Lyft could take care of that very easily if we could fund them and use our federal funds as at least a part for that.
Right. I know that's being considered more and more by folks around the country. So it'll be interesting to see if any of the rules change. One thing I really love working with David Pack, who's my boss here and who gave the presentation, is that he has a business background and is very good at digging into the details of funding and what different funding source can pay for. And so, yeah, maybe another task that we do is sort of looking into, are there state funding sources in Arkansas that could pay for TNCs to complement your transit? Thank you, Ken.
Mm-hmm. That's the same program that I was talking about that has the $11 a month discount. And then even some of our patients, not all are in wheelchairs. So some of them, if we had that ability, could use Uber or Lyft if we had that, if it was set up in the system of the transit system. And I think that's the way it would have to be set up for us to be able to use it. But yes, this is a very good program that they have in Pinellas County.
Any other thoughts or comments on, case studies or examples that caught your eye or you might like some further research into? One thing that David did do before the meeting, and I'm not sure if he talked about it in the presentation because I was trying to figure out how to assign people to groups while he was talking, but was he looked into some of the state funding sources in Arkansas and did find that there are several existing sources, actually FTA funding sources that are typically used for public transportation for, the fixed route systems and the demand response that are eligible for funding for a mobility manager. And so, when we did this research, we found that, the state of Arkansas has, and also Oklahoma they both have statewide transit plans, and both of those plans highlight having regional mobility managers to help carry forward with some of these programs. And I really think it's important to have, I think that all of you, that most of us are really busy in our jobs, and, unless there's somebody who is specifically paid to move some of these programs forward, folks don't always have time to move forward new initiatives. So, hiring a mobility manager, using existing sources like some of the existing FTA funds could really help move some of these initiatives forward in your area. Any other thoughts on that number 2 there? The next question is, how can you and your organization be part of breaking down transportation barriers for members of the rural community? And again, I'll just open it up for you to offer any thoughts that you have.
This is Tracy McKenna with the Western Arkansas group here. And Jarena was part of a meeting that we had with Reese last week on another project we're working on. But the issue came up of the stigma around public transportation that we kind of perceived as an issue here in the Fort Smith area. So I know that I had spoke to Reese about that as well that day, about trying to work on the stigma issue, perhaps get some community leaders, well respected in the communities, to spend a day riding the transit, in addition to the work that Reese and Cody do taking their surveys, but to have folks intentionally use the transit that don't usually use that method, to kind of open their eyes to maybe some of the issues that are being experienced by those who do use it on a regular basis, and then to help break down those stigmas that everybody can use the public transit in the same fashion that those who currently use it, and that it's no indication of your income or your life status, that it's just something that we do here in Fort Smith.
Great, thanks.
This is Kim. I think it's hard to answer how our agency could help without really knowing what we're going to put in place. But certainly, we as an agency are committed to helping families find transportation and are willing to play a role in that if we are able to come up with some solution that can help our families get to where they need to be going.
Great, thank you. David's calling me. I think we're running out of time. Hi, David.
Hi, how do we all get back together?
How do we get back together? Okay, I think that I can send everybody back to the main group. So, yeah, I will go ahead and do that now.
Okay, sounds good.
Okay, thanks. Okay, sorry, I lost track of time, which is not uncommon. Thank you all for participating. I'm going to see if I can figure out how to get folks back all to this main group here. All right, so I just clicked end all breakout sessions, and it says that they will end in 48 seconds. So I think that, yeah, we'll get the other group will come back into our main session here.
Hey, Rebecca, I just sent you this is Ken, I sent you a email that has links to portals that these are brand new for our department, but it actually shows a map of the fixed route and where the buses are in relation to the specific bus stops. So it's kind of a ongoing map of where the buses are. Very good for orientation of using the fixed routes. So feel free to send that out. We haven't actually pushed that out yet. It's still kind of in a testing phase, but for those in this group, I think that could be helpful in at least knowing where the buses are at the point in time of day where, in their proximity. So might be some helpful information.
Thank you, David.
So it's like a real-time bus tracking system?
That's correct.
Okay. When will that go live?
It's actually working now. We're just testing it here. Probably within the next week or so, we should be trying to do some sort of a campaign to push that out to our users and residents in the area so they can access that. But it's very helpful, I think, in helping orient where you are in relation to where a bus is.
Great, thank you. Yeah, I just added those to our notes.
Well, I think we're all back together, Rebecca.
Okay, great. It worked. A little clunky, but yeah, we got it to work. Thanks for sticking with us through that. So yeah, I took over the screen, David, with our notes from our, our smaller breakout group, and have them up on the screen now. So yeah, I'm not sure if maybe one way we could do this is we could report ours out, report out some of the key points of our conversation, since that's up on the screen now, and then you could share your screen and share the other group's conversation. Does that sound okay?
Yeah, sounds good.
Okay. I assigned Ken Savage with Fort Smith Transit to report back. I have some kind of really long notes here, but Ken, do you want to take a shot at sort of reporting back our conversation to the broader group, or what you see as the key points?
Sure. So, in the first question, I think it was asked how someone, that is facing a transportation barrier is able to travel around the region. And, so we just kind of got into an open discussion about all these questions. And one of the first things that I think Cody shared with us was what he had learned in a survey, which was on free ride days, it becomes a barrier to our routine riders, where they're used to doing things the normal way. Suddenly we have a free ride day, and we have this all these people joining into the system, and it tends to impact their ability to travel the system as they do it normally. So a little bit of a difference there. And then another one was comments that were made were no transportation late into the evening, and longer hours would be needed, and to increase transit. And then there was some comments about the on-demand service being hit or miss, and the fact that it's not a direct service, picking up in one origin and taking it to a specific destination without interruption. It's a scheduled service versus a more of a direct service. So a little bit of differences there. We talked about time to access places, 1 hour headways versus something that might be a little more frequent. So frequency of service was brought up. And then also the fact that there was no service in Crawford County. So where frequency of service might be an issue, lacking service completely is certainly an issue. And then the next one was 65 plus may get off late at work at night and have to rely on family and friends, but that is possible. And in our surveys, I think we see that 90% of those that use the transit don't have access to a vehicle. So those are some of the comments that were made there. And I'm not sure if I'm blending into the next question or not, but TAP tickets was one of the things, or transportation assistance program tickets was brought up as a kind of a helpful thing, which is like a voucher that the Fort Smith Transit provides, a limited voucher to agencies to help with getting access to transit. And then that dovetailed into the voucher program, I think, that was presented at the webinar, and the cost of, and then a question came up about cost of dialysis trip being up to $60 for a one-way trip, and that being even impacting to those that may have the higher amounts of money that can access that. It's just very costly and draining late into the evening. And then there was some discussion about case studies and options that were discussed at the webinar. And then interest in the volunteer program with vouchers at HealthTran, I believe it was. And then medical programs sounded good for medical services was brought up, and then job access transportation, and to seek some state funding that might help with that, a little bit more than what is actually available now, which would be very helpful. And then we talked about how TNCs could be used for patients not necessarily requiring a lift, but they could also be used, TNCs being transportation network companies such as Uber and Lyft. And then we got into a discussion about use of FTA funds for mobility manager, and then stigma of public transportation, and having delegates ride the transit and speak of their experiences as it being not a thing for a certain group of people or whatever. It would be something that's public transit is available to everyone. And then, it's difficult to answer some of these questions if you don't have a correlation to it, like a need that's specific to needing public transit. So that was where we left off as far as my notes.
Great, thank you, Ken.
Uh-huh.
David, maybe I'll give you, can everybody see the screen with the notes on it? Let's see. David, I'm giving it back to you so you can share your notes.
Okay. Let's see here. All right. So, when we talked about how people are getting around, we heard about relying on family quite a bit. There's the Medicaid provider that's obviously only for Medicaid scheduled services. We talked about that, Mercy has 3 vans, their own in-house service, and are giving around 450 to 500 rides a month. So doing what they can, but we've heard that, it's maybe harder to get that service out. So, that's one thing. Within Fort Smith, we talked about walking and biking as well as family. The Area Agency on Aging does provide some rides for seniors, as we talked about all the different 5310 programs, those that have vehicles. We talked about things, the vouchers with the taxi company, when the Mercy vans aren't available or in other situations. Even talked about things about fuel cards to say, some people might have enough money to have gas for kind of local trips, but certainly for those longer distance trips, they might need help. We talked about vans at some of the homeless centers and facilities that might be able to get folks to and from work. Could we use vans to get students to educational opportunities from the Alma area? We talked about possibilities for car share. There was discussion that one church in Fort Smith may already be doing something like that. And certainly those could be used for some medical trips and other things. So, when we've heard about organizations staying engaged and being part of this, we talked about Mercy having the vans, and that they certainly want to hear if there are people who can't access that. The importance of building partnerships, working with low-income individuals. We talked about just that effort to keep planning, to keep coordinating and moving forward towards implementation. Can we get to that kind of one-stop shop where there's that source of all things related to transportation and mobility to look at all the options that are out there? Again, having those contacts, keeping the momentum going. From the transportation needs, we talked about, it's really quite a few, that access to jobs and other social services, not only higher education, but being able to get to adult education to get your GED, so that you have that high school equivalency. We talked again about resources. People might have funding to have gas for a short trip, but not that longer trip. And, those trips from the rural areas into Fort Smith and certainly then, as previously mentioned, the hours of service that you might be able to get into, something like the Social Security office or something. But when you're done, the transit might be over. So how do you get that trip back out? So a lot of needs out there. When we talked about who else to be involved, Health and Human Services, the county area agencies on aging. We talked about the Chamber of Commerce and then the Fort Smith Regional Alliance. And then one of the conversations was about, could local libraries be a car share location because they, also provide internet access to folks who might not have it at home. So an option there. And we also talked a little bit about, the mobility manager and sources of funding for that. So, certainly some similarities between the groups. So.
Great. Thank you, David. Is there anything, maybe we'll go to any questions. Well, maybe I'll jump into the closing and then we can see if there's any questions at the end. Okay. Great. So, we really appreciate all your time today. Our main objective was to bring you all together, the stakeholders in, the rural areas around Fort Smith, to just have a discussion about which needs are the most important and which pilot projects, might be most feasible. So in terms of our remaining tasks for the feasibility study, in November, we'll talk about if we need to have a stakeholder survey to get more information. I guess we'll talk with Reese and Sasha about, do we have enough information or is there a need for a survey? And these are some topics that we had discussed to really dial into which solutions are the most feasible based on which are the highest needs in your area, and helping identify the local champions like yourselves who can help move things forward in your area. And then what is the readiness of local organizations to participate? I think some great ideas came out today of, that you all had. Thank you for how your organization might participate in this effort. Is, do we need to reach out to other organizations as well? And then in December to sort of wrap that all up into a document and, maybe have a closeout meeting with folks. Our actual contract goes through the end of July, so if there are items, we'd like to get all this wrapped up for your purposes by the end of this year. We think that would be valuable, but we could be available to do some follow-up tasks, through July if needed for, I don't know, perhaps looking for grant funding or, other items that writing a mobility manager, job description or other items that, that come out of these discussions. Let's see, next slide, David. I think you still have.
Well, if people have questions, and I am a very limited Theodore Roosevelt historian, why you'll see so many quotes from him. But as we've talked about, at the point where Rebecca and I and the group are really done working with you folks, that that we hope that this continues and some things can get implemented. And so, as private industry, it's interesting that people say, do rapid prototyping and fail early and often to get to where you ultimately want to go. And yet when we get to, government, it seems like so many times we want to go, oh, we can't do anything until we know what's going to be perfect. And so, as we talked about earlier, let's talk about what some solutions might be that we could implement. And let's talk about, running things as pilot projects to say, hey, you know what, we're going to try this for a year and see how it works. And if it doesn't work, we go, wow, we learned a lot by trying that. And it might lead to a better solution. So, that's where we want to go, is to say, let's, talk through all of this and really look at what are some good feasible solutions to implement. Some might be pilots, some might be, again, just finding some funding. So, Ken can run the bus service a little longer, some of those other things that we can look at doing. So, again, it's going to be incumbent upon all of you to keep this momentum going as well, and to figure out how to move forward. And that could be saying we need to hire a mobility manager to help keep us on track and to keep the process going. So with that, I just say, like Rebecca, we thank you for your time and certainly would be happy to answer any other questions you have at this time, or if you have any closing thoughts, we'd appreciate hearing them.
Well, I definitely want to thank everyone also for attending and taking their time out of their day to provide us with information. And thank you, Rebecca and David and the entire Montana State University team.
David, this is Mary McGill. Again, let me thank you for having this presentation. It means a lot. We know that if we want to be the region of the future, we must have adequate transportation. It means a lot to recruiting new businesses. It means a lot to recruiting families. We want Fort Smith to be a place where people want to live, and adequate transportation is one of the keys. So again, thank you very much, and hopefully we will take a chance to do some of these things and find out whether or not they work. And we will ask the questions to locate the funding and resources we need to try some of these things. We must keep our eye on the horizon because competition is stiff. And we want to make sure at the end of the day, if somebody is looking at Fort Smith in this region, they will be able to check off that we have good transportation for all of the citizens. Again, thank you very much.
Well, appreciate that, and thank you. And yeah, it is important to have that, to be that community that people want to move to. And, more and more research is saying that people will pick a place that they want to live in, and then we'll find jobs there. And so I think, as you said, having that transportation infrastructure that helps and will draw people in is very important. Any other closing questions or comments? Again, we appreciate all your time. I'm still hoping to come down there and meet all of you in person. It's hopefully we'll all get there, and in this craziness that is COVID will be behind us sometime in the not too distant future. So
I invite you to come, make it a point to visit Fort Smith and the River Valley. I would be delighted to give you a tour of our great area.
All right, appreciate that. Thank you. Well, if there's nothing else, thank you all so much for your time. Enjoy the rest of the day and the week, and I'm sure you haven't heard the last of us. So, as Rebecca said, we'll be talking to Therese about some next steps, and look forward to continued conversations and moving the process forward. So thank you all for your time. Take care.
Thank you, David. Rebecca, thank you.
Thank you.
Thank you.
Thank you.
Thank you.